Hello and welcome to today's 405D National Cybersecurity Updates webinar. Thank you for joining us on today's webinar. Before we get started, I would like to take a moment to just go over a few administrative details. As you have noticed upon joining the webinar, everyone has been placed on mute for the presentation. At the end of the presentation, there will be a question and answer session. So in your GoToMeeting control panel, you'll see a questions box. Please type your questions or comments into the field and hit enter. Please note that the recording of this webinar, along with the slide deck, will be posted to the WEDI website, and downloading instructions will be emailed to all registrants following the live webinar. And you can actually go ahead and download the PDF version of the slide deck from the handout section in your GoToWebinar control panel. So without any further ado, I'd like to go ahead and hand it over to Mr. Lee Barrett.
Thank you, Sam, and hello, everybody, and welcome to our webinar. And as Sam said, we're going to be talking about the 405D and giving you some of the cybersecurity updates. I think you are all going to be very interested in a lot of the artifacts and work that the 405D group and various waves have developed. And so let me introduce Phil Davis, who is the Director of IT Risk and Compliance for Community Health Network in Indianapolis. It's ranked among the nation's most integrated healthcare systems with over 200 sites of care and affiliates throughout central Indiana. So with that, Phil is going to take you through, and then I will anecdotally be adding to his presentation on a lot of the work efforts that the 405D has been doing. And then I have some questions that Phil and I will be talking through, and certainly we welcome your questions. So as he's going through the slide deck, if you have questions, please do type them in. We really want this to be interactive, and we're looking forward to your participation. So with that, let me turn it over to Phil to take you through the 405D slide deck that has been developed here. Phil.
Thank you, Lee. Thank you. And good afternoon, everyone. Thank you so much for hopping on here and for your interest in the 405D task group. And also a special thank you to WEDI and ENAC for putting this on. This is always a special opportunity for us in the 405D group. I know Lee feels the same way, to get in front of those in the field, right? Healthcare professionals that these threats and these practices that we'll go over are affecting on the front line. So it's phenomenal to see the interest in the updates that we have for you today, and I hope what we've got prepared is some engaging, relevant content. I know this is stuff that affects all of us across the board, and I'll get into that as we go through some of the materials here. But like Lee said, any questions you have, any interest you want to express in getting involved in the 405D group, we'd love to get from you. So as we dive in, kind of be thinking about this stuff. Think about how it applies to your organization, and if you've got specific questions, we'd be happy to engage in that discussion at the end of the presentation, and also going forward, right? Lee and I's contact info are on here. We're always happy to continue the discussion after these are concluded. So let's go ahead and dive into the materials here. What you see here, and what I wanted to point out, is the 405D task group is a partnership. It's a public-private partnership between the federal sector and the private sector. HHS is Health and Human Services Office, plays a big role in coordinating this effort, and it really is an effort. It's a large-scale collaboration between those of us in the private sector. As Lee mentioned, I'm work for a health network in central Indiana, and I'm part of the 405D group. And myself and others in similar positions to me at healthcare providers, as well as payers and increasingly medical device companies, as well as business associates, those in the consulting world, are all a part of this partnership, where we get together, share ideas, and really try to move the industry forward from a cybersecurity perspective. So you'll see quite a few different federal departments that are involved in this effort. You know, the health and public health sector, the HPH Sector Coordinating Council, HHS is involved. So it really is an effort of a lot of different departments coming together for one common shared goal. So let's look first of all, kind of the state of the healthcare and public health sector. It's no surprise, I'm sure, to those on this call, the threat landscape that we're in nowadays. And it's really staggering to see the amount of records that have been exposed or that were exposed in 2019 versus the amount that were exposed in 2018. You can see 38 million in 2019 versus 7 in 2018. That just kind of drives home the point of the amount of attacks that we're seeing in healthcare, as well as the scale of the attacks, right? So these are large scale breaches that are happening in the sector, but that doesn't mean it's just large organizations that are experiencing these attacks, right? This is something that across the board in the health sector, from your smaller independent 3 physician practices all the way up to your highly integrated multi-state, national level provider organizations, as well as your payers, right? Your insurance companies. All across the sector, we're seeing upticks in attacks. And again, this is driven home again by this 4 in 5 U.S. physicians have experienced some form of cybersecurity attack. And I would, this stat's about physicians, but I think we could say similar things about nurses, about advanced practice providers, about those in IT. This is across the board. And again, interesting stats here, 15% of breaches involved healthcare organizations. Think about that. One sector accounts for 15% of all breaches. This is something that is unfortunately super lucrative from the attacker's perspective, and the attacker space is well aware now of the value of a health record. And that's also echoed in the 43% stat there of breaches involving smaller organizations, right? So this, again, drives home the point. This is not just big players that have to worry about this. This is everyone in our sector.
So Phil, I've got a couple of anecdotal adds here. One is that in Connecticut, for example, about a month ago, there was an attack on a hospital network. All their physicians and physician practices were affected for 2 weeks due to a ransomware attack. It was unbelievable. And patients couldn't get their information. Patients needing surgery couldn't get the information that they needed. It was an unbelievable attack. The other, going back to your point on the 15%, you were indicating the cost here, especially when you start to look at it. You compare if your credit card record is stolen, it's worth about $1 on the black market, versus your electronic health record is worth anywhere between $500 to $800 on the black market. The issue is, and it's all about what attackers can do with your information in relation to fraudulent claims, drugs, medical devices, other types of things that they can do, and they can be racking up millions of dollars in costs to the industry until usually these attackers know they've got about 9 months to a year before they then will drop it. But in that time, you've got millions of dollars that have been impacted, and that's why the cost is so high. That's why this attack vector on healthcare will continue to be a major target for a long time to come. And I think the other thing is that as you start to look at these stats as well, it's the fact that today it's not a matter of if an organization can prevent an attack. Clearly, I mean, all the work that goes into doing that is extremely important. But even the more important is when an organization is attacked, how quickly they can respond and minimize the impact to patients and customers and from a variety of aspects. And so that's why the whole contingency planning aspect becomes so important as part of this. So I think the stats are very compelling, but just to put in perspective why some of this is happening as well. Thanks, Phil.
Yeah, those are great points, and there is certainly a large financial impact, a large financial risk that cyber attacks pose to healthcare organizations. And you're right on the nose in terms of it's not if, but when, and what you do about it when it happens, right? It's about being prepared and having the processes in place to mitigate the effect and restore the ability to provide patient care as soon as possible. And those are things that you'll see as we get through the materials here. That's really where the 405D materials focus is, yes, you need to have defenses and controls in place, but just as important is your resiliency, your ability to respond to these things, because you're right. The reality is no organization is 100% safe, and cybersecurity is not an effort in reaching a goal. It is about constantly adjusting to address the risk and make sure we are providing resources in the correct places that provide the proper level of mitigation for each one of our organizations. And it's not a one-size-fits-all either, right? This is something that each organization needs to be aware of the threats, and they need to be aware of the practices to mitigate those threats and be able to apply them in a way that makes sense for them. And that's exactly what Hiccup does, that we'll see here in a second. The main document from the 405D task group it allows organizations to do. And similar on this concept of impact, right? We talked about the obvious financial impact that this can have on organizations. But one of the things that the task group does not lose sight of is that this is all about patient safety, right? The impact on patients themselves that cyber attacks can pose is just as important as thinking about the financial, regulatory, reputational risks that cyber incidents can have on an organization. So you see here in the slide, something that we really like to drive home is that cyber safety is patient safety. They're one and the same. It's one piece of the patient safety puzzle is good cyber hygiene. Think about medical devices. Think about availability of care, right? You see a big "sorry, we're closed" sign, and in your example that you mentioned, sometimes a site of care will have to shut down for days, weeks, depending on how prepared they are for an incident like that. And those are real patients that are getting turned away for care. It's a real patient safety toll if we're not prepared for these types of events. So cyber has all sorts of implications with patient safety. And I saw also an interesting story recently that after a cyber breach, in a study that was run, they found that mortality rates actually went up post cyber breach because organizations were implementing all sorts of cyber controls without necessarily thinking about the impact that those would have on patient care. So I think it's really important that we bring all this back to why we do what we do in healthcare. It's to take care of our patients and to make sure that we do everything we can to ensure their safety. And taking a look at the next slide, this is another way to drive this point home, right? In healthcare organizations, I think we can all attest that we receive all sorts of training, mandatory trainings, and in that training is always hand hygiene. Wash your hands. Make sure you're always monitoring the hygiene of your hands that are touching patients, right? Well, similar, cyber hygiene is just as impactful to the patient safety story, right? Once we kind of realize how cyber safety impacts the safety of the patient, it's just another tool that our organizations and our workforce needs to employ in order to keep our patients safe. So while I think it's fairly well understood that you got to have clean hands when you're dealing with the patient. We are still on this journey of kind of the culture shift to ensure that cyber safety is equally top of mind for all in an organization, right? Not just those touching patients, but your accounting department, your HR department, those who may not directly impact patients, but you have just as much of an impact on the patient safety story as the rest of the organization who is providing direct patient care. So that's something that I always like to point out and start and bring back to at the heart of it all is it's all about patient safety. All this cyber work that we do comes back to keeping our patients safe. But one thing I want to do before we get into kind of the threats and the meat of cyber risks that healthcare organizations face is talk about the 405D group, how it came about, where did it start, what's our mandate, what have we been doing. So this slide gives a nice overview of kind of how the 405D group story began. And I'll start there at the top right. You can see our mandate. Right, so this came out of the Cybersecurity Act of 2015, and there was a section of that legislation, 405D, that mandated the creation of a group who would strengthen the cybersecurity readiness of the healthcare sector. And the way that came about, if you move to the left, the 405D initiative is an industry-led process to develop guidelines and practices and methodologies to strengthen our sector's cybersecurity posture against the threats. And it's, as I mentioned before, in conjunction with federal partners. So who's participating? The task group convened by HHS and combined of over 150 InfoSec professionals and officers and medical professionals, privacy experts, industry leaders, as I mentioned before, all coming together to talk about how do we increase our sector's readiness and preparedness for cyber events. And as you go down to the kind of the timeline, you can kind of see where we've been, where we're going with the 405D task group. Starting there on the left side in 2017, HHS convened the task group, leveraging the healthcare and public health sector, critical infrastructure security, and resilience public-private partnership. Again, you'll see a lot of these federal organizations popping up here because it really is a large-scale federal private effort to get everyone in the same conversation. We did pre-testing, and then what I really want to point out here in the middle is the release of the HICCUP document, and I've referenced that several times. What that stands for is Healthcare Industry Cybersecurity Practices, HICP. We lovingly refer to it as HICCUP. And what that is a document with several other resources that go along with it that talk about the top 5 threats faced by the healthcare sector. And again, these are threats faced by your smallest all the way up to your biggest organizations across the board, threats that we faced, and on the other side, the 10 practices that can be put in place to address those 5 threats. Some of the stuff that we're doing, we released HICCUP obviously in all the materials, we'll go through that. But what are we doing now and into the future? You can see down there at the bottom right, the waves that have started over the last year and a half or so. And really what these efforts are about are drafting updates to the HICCUP document itself, drafting new supplemental materials that go along with the document. And wave 3 is looking at creating new content, again, all with the goal of preparing the healthcare sector from a cyber perspective. These are not things that are static or are the same from year to year, right? This is an ever-evolving space. And the 405D group is really well positioned to move the industry forward from the perspective of bringing all these groups together, seeing what is developing and addressing them with practical publications that the industry can use together to, again, go back to our mandate, strengthen the cybersecurity resiliency of the HPH sector. So what we'll get into here is the actual 5 threats that the hiccup document has identified, and these were arrived at based on a number of conversations that were held between the federal sector and the private sector. You know, what are they seeing at the federal level? What are we seeing in the private sector as our main threats? And we really wanted to hone in on the top 5, right? Where are the areas that organizations need to focus in order to get the most bang for their buck, essentially mitigate the most risk by focusing on a narrow number of areas. And there's opportunities to build upon this, and that's what those waves are doing. But what we want to do is go through these 5 areas, as well as the 10 practices, to give you an idea of here are the activities that you should be looking into from an organizational perspective to mitigate the most cyber risk. And so you'll see here that the 5 areas are email phishing. Obviously, I think we can all agree is one of, if not the top risk that healthcare and honestly most other sectors face right now. Email phishing, ransomware, loss or theft of equipment or data, insider threats, and that could be accidental or intentional data loss, as well as attacks against connected medical devices. Those are the 5 areas that we've identified as the most important to focus on from a threat perspective. And you'll see on the left-hand side, the hiccup. This really helps to kind of understand what hiccup is. It's a main document, and the main document is about 40 to 50 pages. A lot of really good definitional information about what these threats are, what they look like in the real world. But really where the rubber meets the road and where the meat is in the 2 technical volumes that go along with it. And those are split up by small organizations and large organizations. As I mentioned, these materials can be applied by organizations of any size, from the smallest to the largest. The technical documents really do a good job of saying, all right, small organization, that's no problem. Here are the things that you can do to implement these practices in a way that makes sense for a small organization, right? If you've got 4 PCs, your implementation will be look a lot different than someone who has 15,000 PCs to maintain. And so that's the difference in the need for the 2 technical volumes, whereas the main document is really kind of a universal document that just talks about these threats, what they are, what they look like, why it's important for all healthcare professionals to pay attention to these threats, and not just IT, right? This is not just an IT problem. And again, there's also resources and templates that are available, made available by the group for practitioners to use as well. So those are the 5 threats. What you see here are the 10 practices that have been identified to mitigate those threats. Obviously, we'll go through these here because we're not going to get into them a whole lot for the rest of the deck, but I do want to make sure we highlight them. The first, email protection systems. Obviously, with phishing being the threat that it is, protecting your email is project number 1, right? You want to make sure that you have in place scanning at the very least, right? Scanning the emails that are coming into your organization, some type of spam filtering, throwing out the junk. But you also, there are tools out that can scan links for malicious websites being behind them before they end up in an inbox, scanning attachments, things like that. Email protection systems is imperative for protecting the number 1 threat vector that we see across all industries. Endpoint protection systems, right? How are you protecting your laptops and your desktops that are out in your environment? Do you have antivirus on there? Access management, also huge. Are you making sure that those in your organization have access to only what they need to have access to. Are you removing access when someone leaves the organization, or are you changing access when someone changes position within the organization? These are the kind of details that the technical volumes get into on how to implement these things at a small organization all the way up to a large organization. Data protection, loss prevention, right? DLP technologies, monitoring your environment to see what information is leaving your network, what those in your organization are accessing, how they're accessing it. Are they exfiltrating lots of data, right? Number 5, asset management is huge. You can't protect what you don't know about, right? Being able to track the assets in your organizations, both from a hardware perspective and a software perspective. How many applications do we have in our environment? So that's asset management. Network management, obviously huge, right? How is your network segmented? If one of your sites is affected, one of the PCs at your site gets infected by ransomware, can that ransomware talk to other areas of your organization? And then thus now you have a much larger problem on your hands, rather than if the network was segmented, only a portion of your network would be affected, right? This gets into mitigating the effects, right? It's not about necessarily trying to get 100% prevention, but it's about processes of mitigation, making events not as bad as they could be. So network management, vulnerability management, obviously you want to know where your vulnerabilities are. Do you have unpatched systems? We'll get into it in a second, but medical devices is a huge area of concern right now with vulnerabilities. Medical device manufacturers sometimes aren't releasing patches quickly or not at all for identified vulnerabilities in operating systems that they run on. How do you handle those sorts of situations? Are you segmenting off vulnerable systems? A lot of that goes into vulnerability management. Incident response. Again, we keep coming back to this concept of being ready, right? What's your response when the inevitable happens? Incident response can make the difference between, a security incident and a security breach, right? How quickly you can identify suspicious activity and what you do about it. That's your incident response process. And again, medical device security, called out on its own here. How are you segmenting your medical devices? Can they talk through the rest of your network, or can they only talk to what they need to talk to send the data where it needs to go? And again, cybersecurity policies. This is the overarching practice, I think, to all of this, right? And this is about your organization as a whole sharing responsibility for cybersecurity. It's not just an IT problem. It's about making sure your organization is trained and aware of the proper way to use the technology that we are making available to them. So these are the 10 practices. Great way to focus your energies in these areas to combat the 5 threats.
So Phil, just an anecdotal comment as well. One of the things that I was attending a session 6 months ago, and they had an FBI agent that focuses on cybersecurity, and he was talking about one of the other ways when you're talking about things like network management. A lot of people don't think about, for example, are machines like fax machines. And he was talking about a particular instance in which a malware was able to be placed and gone through the fax machine to actually infiltrate the entire enterprise and to compromise the entire enterprise. So it's just, when a lot of people just don't think about fax machines or other types of units like that as being, quote, threat vectors for infiltration of malware or other types of viruses, but they absolutely are. So the whole aspect around network management and asset management are extremely important to understand what all those threat vectors are within an organization.
Yeah, that's a great point, and kind of reminds me of this whole transition to IoT, right? Internet of Things. We have so many connected devices on our networks now, smart TVs, smart assistants, right? And these things are being plugged into the network. So, what is your procedure for identifying devices that are plugged into the network, and are they able to just have carte blanche access, or are there technologies in place to identify new devices and segment them off uh, in partner networks, or networks that don't have access to the internal sensitive resources? It's a great point. And so as we go kind of further into talking about hiccup, before we get into the actual threats, this is kind of a helpful visual to understand what hiccup is to you as a healthcare organization. What purpose does it serve? And you can think of it really like a recipe book. It's kind of like a cookbook. It will say, to mitigate, in this example, to mitigate email phishing, what do you need to do? Well, have email protection controls, have multi-factor authentication turned on, train your workforce, have incident response policies for when you see a suspicious email. What does your service desk do, or what does your IT support person, what steps do they need to take to quarantine that message, make sure it's not spreading? Have you put in place digital signatures, right, to verify the authenticity of senders? And also, what kind of next gen tools are there, right? So it gives you a lot of different ingredients, and you can say, well, based on my situation and my organization, here's how I think these should be compiled together and mixed to address this risk. Just like, the line at the bottom there is great. The skill of the cook is what makes the dish. So that's why we, kind of cybersecurity practitioners and IT practitioners, are in a position to really take a look at our business, right? What business processes need to be protected and to what level, and then to recommend the appropriate level of protection. It doesn't say you have to have all of these things in order to mitigate this risk. It says here's everything, or the most impactful things to mitigate this risk, and you're able to choose, right, using those technical volumes based on the size and needs of your organization. And again, just on this idea of how do I decide, am I a small, am I a medium, am I a large organization? There's a tool in the document to help you kind of categorize yourself, and that really comes into play in those technical documents, right? If you're a small organization, you don't want to be looking through the large organizational technical document. It's large, 100 pages, has a whole lot of different enterprise technologies, where you may just need to put multi-factor authentication on 5 accounts. So the tool really allows you to say, okay, what size am I, and where do I need to look in order to see what the most impactful controls are for me in my organization. Lastly, before we get into the threats, I do want to make sure I highlight, it's not just hiccup that the 405D group has produced in terms of resources. You'll see there at the top, the 5 threats have actual kind of posters that were created last year for National Cybersecurity Awareness Month, CSAM, in October. And these are posted and out there on the 405D site. We will have that link at the end of this deck for everyone to go to. They're posted out there, and these are designed for you to be able to post in your organization for your caregivers, other workforce members to see, particularly in Cybersecurity Awareness Month, or just anytime during the year, right? It's important that we get these concepts out to the rest of our organization, so they understand that this is not just an IT problem, right? This is something that I impact each and every day. So those materials are out there. The outreach program for the 405D group is great. You can see their bi-monthly newsletters, articles written by 405D members on certain hot topics in the industry. It's great to socialize that and forward that around your organization. Again, about building this awareness. So those are out there. Obviously, the hiccup publication is great the main document itself, like I said, that 40 to 50 page document is a great document to forward throughout your organization. It talks about these threats in a way that operational folks can understand, not just the technical folks in your organization. And one new thing I do want to make sure to point out is the social media accounts. These are fairly new and a great resource to kind of make sure this is always top of mind for us as well, right? Always pushing out content about hot topics similar to the newsletters, and those can be found at Ask405D on I believe all these social networks: Twitter, Instagram, Facebook, and 405D is also has content on LinkedIn as well. So I want to pause there. Lee, do you have any thoughts kind of before we get into these actual threats themselves and what we can do about mitigating them?
So you know what, Phil, I think your review of all the documents and all the various aspects on the social media, which you had indicated is new, and it is. I do think that the newsletters and the documents that are available to all of you as resources are terrific. And one of the things that's important is, and Phil talked about it, is the fact that there's really a good scoping tool to determine size of organization. And one of the things that we spent a lot of time on is to assure that the level of expertise, the level of information that was provided was geared to the size of the organization, so that organizations, so a small, for example, solo practitioner is not overwhelmed with a lot of information that really is not applicable to them. So a lot of time and effort in these pre-testing sessions was spent in going through and kind of vetting all of that to assure that the level of information was appropriate to the stakeholder. So I do think that what you can come away with here, and as Phil said, we'll have the link for you to be able to get a lot of these materials. There's a lot of great materials and resources that are out there as a result of this effort that you should absolutely avail yourself of, and certainly I think pass on, refer to other individuals in your organization as well that may have needs. So it's all very good material, and you can actually, again, scale it for your organization to make additional revisions as you need, really going back to the kind of the cookbook aspect. There's a lot of the components and the ingredients that the 405D is providing, but it's really up to the organization as to how they actually cook it or utilize it within their organization. So this is a really good overview, Phil, I think, of the artifacts that the 405D has and is making available today. So thanks.
Yeah, and these are made to be shared, right? These are made to be circulated by those of us in the task group with industry professionals, but also for those who are not in the cybersecurity field, not in the IT field, right? These need to be in front of providers, of doctors, of nurses, and that's what they were really designed for. So absolutely go out there, grab these, peruse the materials. If there's a particular threat that you want to focus on, grab the materials and start circulating it within your organization.
Phil, one other point I'd mention is that on the website as well, there several of us did some audio on each of the 10 specific threats as well. So you can also supplement the materials that we've got here with, if you wanted to listen or refer again to somebody else in your organization to listen to the audios on any one of the threats and the types of documents and artifacts that are available. So that's another reference and resource that's available to you as well on the website.
Yeah, that's great. So let's dive into the threats now. Like I said, the 5 main threats start off with email phishing. And I think those of us in the cyberspace know about email phishing, but I'm continually kind of amazed at the knowledge gap that exists within the healthcare space, right? You've got nurses and doctors out on the floor. Some may have a passion for this stuff and are very familiar with it, but some just are not aware that this stuff happens, right? They're totally trusting of what comes into their inbox. They'll click on anything without thinking twice. So I think it's really important, and Hiccup does this, to define what these things are at a level that any practitioner would be coming from, right? So you can see here the definition. We don't have to read the whole thing, but it defines it as an attempt to trick you, a colleague, or someone else in the workplace into giving out information using email, right? So being able to present this in a way that makes sense to those who are not technical is huge in terms of making sure that they're trained up and able to prevent these threats from manifesting in your organization. So the way you'll see these threats presented here and also in the Hiccup publication itself is a definition, and then the next part you'll see practically how this manifests itself in real life. So again, all about bringing that application back to how would I see this in my organization, and then of course we've got the practices for what you can do about this threat. So this is a good example of something that would be in the Hiccup publication for email phishing. You see the scenario. Your employee receives a fraudulent email from a cyber attacker disguised as an IT support person from one of your patient billing vendors. Email instructs your employee to click on a link to change their password, and once they go to the malicious website, enter in their credentials, the attacker now has those credentials to get into the billing system, right? This is a kind of your basic phishing email attack, but presented in a way, right, if you circulate this in the organization, that they can understand that, oh, I need to evaluate emails because it may not go where I think it's going. So again, this is things we know in the kind of the tech space, but don't take for granted that some of your organization may not be as familiar as you'd like them to be. So again, what can we do about this? Providing the procedural processes, the thought processes that employees should go through when looking at email. These are the tips to consider before clicking on the link. Did you hover over it to see where it goes? Do your employees know URL construction? Are you teaching them about what makes up a web address, right? This is something that we in our organization just started including in our training materials. Is how do you construct a URL when you're looking at one and it says .com, .edu, .web, right? You're going to .web. You're not going to .com. So thinking about how are you training your organization? I know mock phishing campaigns are a huge industry right now, and most, if not all, large organizations are doing them. If you're a small organization, I'd really encourage you to look into that. It's a great way to present real-world examples to your employees and those in your practices to become aware of the issue. So moving on, I do want to talk about ransomware, obviously, because it is so prevalent in our industry and can have such an impact on the patients themselves, right? This is that availability of care piece. And I don't want to say that phishing is not also a big piece of that, right? Most ransomware attacks will start with a phishing email, right? So these are all tied together, but you can see the definitions here are very tailored to operational folks within an organization. Ransomware, type of malware, distinct from other malwares, and distinct in its characteristic that it locks down data and requires you to pay to get access to that data. Important to note that paying a ransom does not always guarantee that you will get your data back and that the key that the attacker gives you will work. But something to note here, and this is something that I always like to point out to organizations, is have you talked with your senior leadership about what criteria you will use to decide if you're going to pay a ransom, right? Is it a blanket, we will never pay, or is it we'll weigh a number of factors to make that decision at the time? I don't think you can ever fully plan one way or the other until you're in a specific situation, but it really helps. I think I've found and have seen a number of cases where availability of systems was really delayed by the fact that no one really knew whose decision it was to decide if we're going to pay. Is it the CFO? Is it the CEO? Is it IT security? Who's going to decide that, right? It really pays to plan these things out ahead of time, do mock drills, and to have these conversations with your leadership teams ahead of time. So no one is surprised, no one is panicking when these events happen. We have a response protocol in place. We know what factors we're going to weigh to decide if we're going to pay, and we have it checklist out, right? We call cyber insurance, call the FBI, make sure we contain the attack, right? Step these things out can go a long way to ensuring that your patients are not being denied care. So again, example scenario, right? Something that we could see in any organization through an email that appears to have originated from a credit card company, right? This is phishing. User is directed to a fake website and tricked into downloading a security update. Now it's infected, right? So what can we do about this? Ask your IT team, right? And if you're a member of the IT team, think about this. What's our incident response plan? Is our network segmented? These are things that we've kind of mentioned several times going through here, all about mitigation of an event. How should we be trained? Do we have backups in place, right? This all goes into that decision-making process of how long would it take to restore our systems versus what's the ransom asking for? These are all factors that would be a part of that leadership discussion. Next one, loss or theft of equipment or data. I think it's important to point out here, this is kind of one of the areas that it's very clear that IT is not the only responsible party for information security and making sure that we keep our patients' privacy intact, right? This is something that all levels of the organization need to be aware of and be doing the right things to prevent. I like to use the example in our organization that IT is not going to be able to follow a doctor to a coffee shop and say, oh, you left your laptop unlocked while you went to the bathroom. I locked it for you, no worries. Right, these are things that all employees in an organization need to be aware of and need to have top of mind, right? IT is not going to be able to prevent breaches 100% of the time because we have users, right? We've got people who are out in the world using our technologies in places that aren't secure all the time. So again, this is an example. Doctor goes to a coffee shop, uses public Wi-Fi to view radiology reports. Already not a bad idea. Need to have a VPN on. But again, laptop picked up, taken away by a thief. Now, if that laptop was not encrypted, all that data could be considered exposed, and now you've got a breach notification situation on your hand. Not good all around. So what are the things we can do to prevent these things, right? The process and policies. Never leave your laptop or equipment unattended. Always lock your workstation when you leave. These are things that would be in your information security policy set, and these would be things that are communicated out clearly to the organization. The biggest thing, obviously, with theft of equipment is encryption, encryption, encryption. If a device is encrypted and taken by a thief, there's nothing they can do with it. No data that they can see on it. So that is you need to be encrypting all laptops, and I would even recommend encrypting your desktops as well. Those can tend to walk away sometimes as well. So these are all things that you'll see in Hiccup. And if you're listening to this and thinking, okay, well, how do I do this? How do I implement encryption on all my devices? You go to those technical documents, and it will walk you through, again, based on whether you're a small or large organization, how you do these things. But I want to make sure that we're pointing out it's not just technical. There's also process and policy ways to address these risks as well. That last one's kind of along the same lines. Notify your supervisor in IT when you notice that a device is missing. So again, one of the thing, a couple more of these threats to go through. Insider threat. Now this can take a couple of different forms, right? You can have an accidental insider threat. This is someone making a mistake, mailing a letter to the wrong patient, or disclosing information to someone on the phone because they didn't verify an identity, right? That's an accidental insider threat. And then you also have intentional malicious insider threats, right? People who are looking up a lot of records they shouldn't be looking up. Again, example here, someone gets socially engineered, someone calls them up on the phone and pretends to be another care provider and says, hey, I need some patient information on patient A. And without properly verifying who you're talking to, just giving out the information on the phone. That's insider threat. What can we do about this? You see, protect your patient's PHI and do not give out information unless you have thoroughly identified the requester's identity, right? This is something that would be in policy. And this is something that would be communicated out via training. Instruct your people to follow your instincts. Always report what doesn't feel right to you. If someone's being overly insistent on the phone that you give up information, right? You tell them, you give them procedures to how to escalate those things.
I think, Phil, one of the other things I was going to mention with this particular one, going back to that FBI agent that I was talking about, he was talking about the fact that one of the other big threats, and it goes along with this, is the fact that a disgruntled employee or an employee comes in and potentially, or either intentionally or unintentionally, will inject a malware into the enterprise. And again, this is probably one of the biggest aspects that organizations can have limited control over, but needs to have appropriate controls to determine if, in fact, somebody who doesn't have access to a particular device or is putting something on a device that they shouldn't be, that there's enough controls in place that it's highlighted. But that's another, major aspect of this particular threat vector that's there for organizations.
Yeah, and that's a great point. And I think we should also point out something that I think we've seen a lot of here recently are the type of insider attacks where someone reaches out to accounts payable or payroll department and says, hey, emails from a Gmail account. They're saying, hey, I'm, Dr. So-and-so, just got a new bank account, need you to switch my payroll. And, in some cases, the employee will just go ahead and make the switch, and then they've rerouted paychecks from an employee into an attacker. And in that case, right, it was the employee's personal account that was compromised. So not necessarily something that the organization could have even prevented, right? Maybe the employee was phished in their personal account and gave up the credentials that way. So maybe they even know that this person has a personal account and it came from the correct personal account. But it's a great opportunity to mention the controls that we have in place to make sure that you have to verify at multiple steps along the way before action is taken, right? Take it to a supervisor, take it to a second person to validate. Make sure you reach out to that person in a vector other than email, right? Call them, visit them at their office to confirm that they want to make this change before you just act. And again, the last threat here is attacks against medical devices. And I do want to make sure we take a look at the scenario of this. FDA definition here for medical devices, but I would also add that I think one of the additions that we're making to these documents is yes, medical devices are very important and do deserve their own category, but we're not just talking about medical devices, right? These could be any sort of IoT devices that are showing up in your networks that all provide an entry point into the network. And I think we know IoT devices traditionally aren't the greatest about having patches available or even being secure out of the box, right? Default passwords and things like that. I think it's important to point out when we're talking about devices, not just medical devices are threats. But I do want to point out this scenario because this is kind of worst case scenario for a cyber attack, in my opinion. Your organization is inflicted with the phishing attack that affects a file server. Someone gets a password that has access, gives up a password, and they have access to this file server that a heart monitor is connected to. While scanning the network for devices, the attacker takes control of all heart monitors in the ICU, putting multiple patients at risk, right? Possibly while they're on the operating table having a procedure done, heart monitor goes down, right? I can't think of a worst case scenario when you're putting a patient at risk because of a cyber attack. So it's really important to think about, where are all my medical devices? Do I have an inventory of my devices? Do I know where they are? And do I have a way to keep track of vulnerabilities that are announced on these medical devices? And like I mentioned earlier, sometimes manufacturers are slow to release patches, right? Vulnerabilities are released and are known, but there's not currently a patch available, or maybe they've said they can't patch because of, you know, X, Y, or Z reason. What do you have in place on your network to mitigate that, right? Are they hyper segmented? Can they only talk back to that file server and nowhere else? So you really limit the vectors that you can have affecting your devices. Just on
And
medical
Phil,
devices. Yeah, go ahead.
Yeah, Phil, I'd also say that one of the other aspects of that is which goes back to not only medical devices but other equipment. The big issue is for organizations and individuals to be pushing out these patches so that they're not even given. People aren't given the option of whether or not they, quote, installed the patch or not, but that they're actually pushed out and installed on equipment. And that's another major risk vector where a lot of there may be an available patch and somebody hasn't loaded it onto their medical device or system, and therefore by not doing that, now there's a particular vulnerability, security hole that's available for an attacker to go after. So that's the other aspect here, that organizations need to be looking at the kind of the pushing out of these patches rather than necessarily giving the individual's employees or others the option of downloading it or not.
Yeah, that's a great point. And that goes directly to kind of what's in this blue box here. What's the governance process around medical devices at your organization, right? I'm a big believer in that. Medical devices needs a governance structure, needs a dedicated governance structure, because traditionally, clinical engineering, the function of, you know, taking care of medical devices, has lived outside of the IT function in a lot of organizations. Now that's changing, and it's being brought back into IT in a lot of cases that I've seen. But with it being kind of segmented like that, I think most IT organizations have patching policies for their servers and for their endpoints, their laptops and desktops. But I've seen that the governance is not nearly as mature for medical devices. And so that's why I think a governance structure and policies need to be in place for how we handle medical devices, right? If there's a patch available, no organization should be using that device without a plan to get that device patched up. And again, common vulnerabilities there in that second point, you would need a process to verify and test those patches before you're putting them live on patient devices, right? And this goes back to that governance structure. It's how are we going to handle it from vulnerability all the way through patch. You need to make sure you're testing these patches properly before you're putting patients live on devices. And so that does it for our planned portion of the presentation. I do want to make sure we point out the website to go to for 405D. There's a lot of great resources there. The contact address for the 405D group is also here. If you have any questions about getting involved or some of the materials that are out there on 405D, please reach out to them. And I know we love to have engagement from those in the community. So absolutely go to the website, reach out if you have any questions. But I wanted to make sure we open things up here before closing things out. So Lee, do you have any kind of closing thoughts or additional questions that we can go
Yep.
through?
Phil, that was a great overview. Thank you very much, and really a lot of good information. So first, let me ask if any of you have questions, please do type your questions in, and we will try to get to those. We wanted to make this interactive. We want it informational for you. So if you have questions, please type them in, and as I said, we'll get to those questions as soon as possible here. So, Phil, I have a couple of questions to kind of hopefully start us off and get people engaged in the dialogue here. So, the first question I had, you've talked about, the medical devices, but the whole issue around, smartphones, especially within, hospital environments, where many hospitals are providing you either they allow the doctors, the nurses, staff to use their own smartphones, or in some cases they're providing phones for the staff. Do you have any thoughts here on kind of the risks that especially hospital environments are facing, and how that's being addressed with 405D? Around kind of bringing your own device to hospitals or others providing devices. Any issues, any concerns that you're seeing, and any guidance that you have for any of our provider or hospital networks that may be listening in today in relation to smartphones that they might be having within their environment?
Yeah, absolutely. And you're right on in that there's it seems like a lot of different ways that organizations are handling this. Like you said, some organizations have decided that they don't want any of their data on a personal device. And so they hand out only corporate owned devices that have full management, full control of each one of those devices. And in some cases you can't even download a new app on those things, right? They want them so locked down. I think in healthcare you'd be hard pressed to find a doctor that wants to be so locked down with their device. I think the key is having a good mobile device management system in place, right? Something that allows you to segment off your corporate data on that device and wipe it if necessary, but also allows the user of that device to keep their personal data on the phone and use it just as they would. It's just segmented off from the corporate data. And there's a lot of tools that out there that you can look into to do that. The one other piece that I would mention is with mobile devices, one issue that I've seen a lot come up with providers especially is messaging, right? Being able to send pictures is very valuable to physicians and nurses in certain situations. Maybe they want to consult with someone a consultant that they have, or another doctor that they usually consult on certain issues with. You want to have a secure messaging solution in place. There's a lot of vendors out there that provide secure medical messaging solutions. I think that's something that you can't ignore on the mobile space, is ensuring that you've got a compliant and secure messaging solution that allows them to send pictures, send out patient info in message form. You do not want them doing that over text message. And so those are the big points I would make on mobile. And on the other part of the question, what's the task group doing along these lines? There's a lot of work going on about future gazing. That's one of the kind of the offshoots of this group is looking at where are things going in the future, and providing guidance and drafting out white papers for the way to handle specific technologies that we see coming up on the horizon. Now, mobile devices has been around a long time, obviously, and there's kind of a mature space on how to manage those things. But these are all things that the task group discusses when we're in these all hands meetings.
I think the other thing too is that the future gazing, and that's where some of the alignment with the healthcare sector coordinating council is coming in, where the healthcare sector is focusing on future gazing and technologies like blockchain as an example is one where they're looking at to determine where there might be vulnerabilities there. I think the other thing that you talked about is that people that are, whether it's doctors or other individuals that may be sending pictures or clinical data, that it needs to be in an encrypted exchange that's going on, so that again any type of exchange is minimized the risk of being able to be hacked. So I think those are some of the items I think that the 405D is also looking at as far as any additional new technologies that organizations or individuals need to be aware of in their smartphones. So thanks, Phil. That was some good advice. We had a question from an individual asking about, hey, what about individuals that work at home that may be working for an organization? What types of things that can an individual that works at home be doing to secure their environment better? Any thoughts you've got there, Phil? And I've got a couple of thoughts as well.
Yeah, that's a great question. And you want to make sure that you're not ignoring your remote workforce in training procedures, right? They need to receive the same training, and if not more targeted training than maybe on-site workers are receiving. And when I say targeted training, they need to know that they need to have their VPN on and connected at all times when they're working on sensitive information or doing any work, right, on behalf of the organization. They need to have their VPN turned on. And that's another point I should make. You should have a VPN. Funneling.
And everybody know what a VPN is. It's a virtual private network, just to in case you didn't know the acronym. So as Phil's talking about, VPN is just another way to secure your environment and on the as far as exchange of data. So sorry, Phil, I just thought I'd tell people what VPN stood for.
Absolutely, and thank you for checking my tech speak on that one. Yeah, the importance of a VPN, really, especially for remote workers, is that whatever policies your IT department and your information security department has put in place. So think like when you're at work or on site, maybe you can't get to Netflix or you can't use Dropbox or certain sites, right? These are policies that an organization has put on their network to ensure that the information stays secure. Those same policies need to be applied on the workstation at home as well. And so a VPN is a way that all of that traffic will funnel through the organization and have those policies applied, those protection policies applied. Whereas if they're just on their home network, a lot of those policies may not apply. And so it's a balance of software you may have on your endpoints, your laptops and desktops, as well as the network protection that you get from that VPN, the virtual private network.
I think the VPN is very important. I think the other aspect for people to be thinking about, especially those working at home, is making sure you have a good firewall in place so that between your router and your system, that firewall is there, and the firewall can be many times the router may have a firewall in it, or you may have a separate firewall. Again, that'll be catching, they're built to catch a number of attacks that could go on there as well. So from an infrastructure perspective, those are the types of things, I think, between the router, Phil's talking about the virtual private network, having a firewall. Those are the types of things that I think that people need to be thinking about that are working from home. As well as, we've talked about smart devices as well, and making sure that the level, if you're doing anything from a clinical data exchange point of view, that you've got the appropriate level of encryption in that data exchange as well. So those are, I think, some important points to think about from virtual or certainly a remote workforce perspective. Great, thank you. Good question. Any other questions? Please please type in your questions. How difficult is it to apply a VPN? Bill, you want to talk about that?
Yeah, absolutely. So from the perspective of, I'll take kind of two perspectives, from the IT perspective and from the user perspective. From an IT perspective, it's fairly simple to push out a VPN solution to your devices if you have the capability of doing that. A lot of times, if you're a smaller organization, you can purchase licenses from some common VPN providers that are out there, and manually install them if you have a low number of workstations. And it's no different than installing like Microsoft Word or another program on the device. And they're very easy to use as well. So usually the VPN, the interface that you'll see when you bring one up is you'll have to enter your VPN server name. And again, these are depending on the type of VPN that you've purchased. If you have an enterprise level VPN, you'll get your own server address. Whereas if you're using a vendor and utilizing all of their servers, you'll put in whatever server address they use. And then you log in with your account, either your work credentials or your credentials for a consumer VPN. If you have that, you click connect, and it takes care of everything else in the background for you. It funnels all the traffic where it needs to go. It's usually a pretty lightweight application on the PCs themselves. So very easy to use from a user perspective, and doesn't have to be that complex. If you're a smaller organization, if you're a larger organization, there usually is a server that you need to stand up, either in your cloud data center or in your on-site data center. But in terms of usability, very easy.
Yeah, there's for example, Phil was talking about, you can download an application if you're a smaller organization. Like Norton has a VPN product that's out there, pretty easy to use. Again, it just, it provides another layer of protection and prevention of access, especially to email and other activities or services that you may be using on your laptop. So it is a very, very good tool and something to look into. Either if you're working for a larger entity, then they may already have a virtual private network installed on your machine. But if you're working in a virtual smaller organization, as Phil said, Norton, or there are a number of others that are out there as well to take a look at, to use. But they're a great another tool. Go ahead,
and
Phil.
Lee mentioned this as well, but kind of bringing this to the healthcare angle, HIPAA essentially mandates that you not send any patient information in over unencrypted channels. And what a VPN does is it encrypts all of your traffic that you're sending through that VPN. So like I said, if it's the type of VPN, and most consumer VPNs are this way, if you're on a corporate VPN, ask your IT department how it handles. You've got a split tunnel and a full tunnel, meaning if it's a full tunnel, all of your internet traffic goes through this VPN. It's encrypted, it's protected in transit as it's going from your PC to wherever you're sending that information. And like I said, HIPAA essentially mandates that you encrypt all patient information that you're transmitting. So definitely something that you want to look into and make sure that you have in place if you are dealing with patient information systems.
Thanks, Phil. Thanks for the questions. Keep the questions coming. So the other kind of follow-up on the smartphones, Phil, is that, I know you had mentioned the FDA, and they've taken a far more proactive stance over the past couple of years regarding providing guidance on medical devices. Are we seeing them? Is there any type of, are they getting more involved in providing any type of guidance on, for example, a certification of some of these devices, medical devices that entities will need to go through in an effort to provide some additional layer of kind of oversight, especially in relation to privacy and security of these, because obviously the vulnerability is there for attackers to get at these. Are we seeing that the FDA is continuing, or do you think that they're going to provide any more guidance or oversight to any entities, whether it's, I know the National Institute of Standards and Technology, NIST, has developed some additional guidelines that and best practices that they're also promulgating in some of their information, and they're incorporating some of that from FDA. But we see it kind of providing more of a level of oversight than they're doing today. Any thoughts there?
Yeah, and I want to say that I've been very encouraged and impressed by the amount of engagement that we've seen from federal organizations like the FDA, like NIST. You mentioned NIST as well, with our task group, the 405D group. I mentioned before, there's a lot of federal organizations that are taking a stake in the work that we're doing in this public-private partnership. And so so to answer your question, yes, I think they are going to take a much more active stance from this perspective. A lot of these medical devices are now becoming tied to mobile devices. We see a lot of, and I know in our organization, I'm sure in many others, we see a lot of the new types of devices are usually connected to a smartphone or a tablet, right? Think like an ultrasound that has a wire that connects to a tablet and allows you to perform ultrasounds right there and view the results right there on the tablet, and that's connected and sending images back to a server, right? And so I think as we get more and more devices that are connecting that way and are using almost consumer grade technologies to back them up, I think you're going to see a lot more guidance coming down about those scenarios. And I would say if you're interested in kind of having a stake in some of that guidance, I found that the 405D group is usually very active in engaging in the public comment phase of a lot of these rule changes and rule proposals, and has even been successful in some circumstances in changing guidance and in changing the rules and procedures that some of these federal organizations have. So yes, I think we are going to get some more guidance and regulations, particularly on those medical devices that are connecting to mobile devices, as I mentioned, and a lot of engagement with the 405D group in terms of what those of us on the ground are seeing and how we think some of this will affect us and our patients.
That's great. Good response. The other thing is, interestingly, probably a couple months ago, I got the opportunity to take a tour of the NIST lab, and just kind of emphasizing what you were talking about, Phil. And NIST was able to take us through and they had a number of manufacturers of infusion pumps that they had in this particular lab that they were doing. And they were working with the vendors of these infusion pumps to assure that the level of security that they had on them in an effort to thwart an attack was consistent, and they were working on a set of standards that all vendors of infusion pumps could look to employ. So there were about 6 different vendors. So it just, emphasizes again, I think, a lot of the great work that NIST, the FDA are doing, and how their engagement with the 405D and a lot of the efforts that are going on in the industry, and the alignment between certainly the federal and the private sectors is really working really well. And I think the other aspect that we were talking about with the Healthcare Sector Coordinating Council, one of the objectives of that group is really to not only align, but also to reduce some of the redundancies that were going on between various entities in the private and public sector on cybersecurity. So a lot of that as well is continuing to evolve, and has evolved over the past couple of years, that these organizations continue to be aligning. And I'm very encouraged as well in relation to the information sharing and I would say the cooperation that's going on between the private and public sectors regarding all these initiatives. So it's really, really good. One question came in on, I guess, somebody's asking kind of defining what clinical information is. So I think, clinical information, as we're talking about it, Phil and I here, really relates to any patient-related data that would be under HIPAA as well, and classified as clinical data under HIPAA. So the patient-specific data, anything having to do with treatment or images as well related to treatment on a patient, would all be considered clinical information. So it's pretty a broad term when you start to look at it, which is why we're emphasizing, both of us are emphasizing the use of using encrypted data exchange or a virtual private network to assure that if you are doing anything in relation to transmitting or exchanging of clinical information with another entity, either point to point or point to multi-point, that you'd want to use an encrypted data exchange for any of that. As Phil was talking about, that's specifically required under HIPAA as well. Keep the questions going. Phil, anything else you would add to that?
Yeah, I think if you're trying to decide what is HIPAA relevant data, obviously there's a legal definition that you can go out to HIPAA and view, but I think kind of breaking it down into an easy way to decide if this is clinical data, as we refer to it. The term in HIPAA is protected health information, PHI, and what you're looking for PHI is any identifiable information to an individual that relates to their health care. So one key word in there is identifiable, right? You need to be able to, by looking at this data, know who it is, whose data you're looking at. So if you're looking at an X-ray picture of a broken arm, and there's no name, there's no demographic data, you don't know how old this person is, you don't know where they live, you don't know anything, all you're looking at is a picture of a broken arm, that's not going to be considered protected health information. That's not going to be clinical data as we're using that term here. Clearly it's data that's used in a healthcare setting, but that wouldn't be the protected type of data that brings you into the realm of HIPAA and all of the requirements therein. So that'd be the only piece I would add, is that you're looking at identifiable information to an individual that relates to their healthcare.
That's a good clarification, Phil. Hey, so another question that I was going to ask is, the 405D, when we first started it a few years ago, That initiative really, we were focusing a lot on the provider community. At that point, there was actually 4 different providers, stakeholder sectors that were focused on with the first set of guidance and artifacts that came out. That they focused on solo practitioners, group plans, group practices, as well as then community hospitals, and then large healthcare networks. And a lot of the information that we had developed at that point was excellent, but we told people, hey, even though it was initially focused on the provider community, other healthcare stakeholders, it was applicable to other healthcare stakeholders as well. Has the 405D now, are they still focusing on the provider side, or are they broadening out as far as stakeholder specific guidelines that they're also providing?
Yeah, we're absolutely broadening out. So this is kind of the portion, the recruitment portion. If you are a part of a provider organization, we still need more participants in the 405D group from provider organizations. But to your question, Lee, we now have members from medical device manufacturers on the task force, and we also have a lot of individuals from insurers, right? So the payers in the healthcare industry, which are also subject to HIPAA, mind you. So we are branching out to a lot of other different healthcare sector types of organizations in device manufacturers and payers. And there's also a large contingent in the 405D group of kind of your consultants, right? Those who are not providers, they're not payers, but they are really experts in the field. They help healthcare organizations be compliant with HIPAA, implement HIPAA secure IT. A lot of these issues we've talked about, they're experts in that field, and now they're a part of the organization as well. That's what I've seen, and the materials that we're focusing on in these next wave sessions that I mentioned earlier are really broadening out and thinking about more than just things from a healthcare provider providing care to patients perspective. It's really broadened into the whole HPH, healthcare and public health sector.
Yep, very good. I think I agree with you, Phil. And on the recruitment side of this, I'm going to as well put in a plug. I mean, if you're interested in getting engaged in the process, the 405D, please, there are a couple of ways to do this. One, if you want to either contact Phil or myself and have wanted to talk to us about specific questions, kind of the amount of work, effort that's involved in being engaged and participating, either one of us would be more than happy to talk to you about what that means as far as time. And really, quite frankly, I will tell you, it's really up to the individual. They are looking for people from the various stakeholders to be involved and provide that guidance into and input into the process, so that as Phil was indicating, to continue to keep the documents enhanced on an ongoing basis. It's critical that as new best practices are developed, that they're integrated into this, as well as any new threats or recommendations that people have. So that's going to be very important. So if you want to talk to either one of us about it, we're more than happy to do so. And then the other, I would tell you, is to go out to the website for the 405D. As Phil and I have both been talking, a lot of these documents are artifacts and resources that are there. I think you'll find very interesting and helpful, and you can take many of these documents and customize them for your own organization as well. So there's a great way to do that. Then the other is the Healthcare Sector Coordinating Council. Is another great organization, and there are a number of work groups that entity has as well that you may be interested in taking a look at and determining where you may want to participate, or somebody from your organization. So please do check the Healthcare Sector Coordinating Council website as well for their information. So first of all, let me thank all of you for your participation on the webinar today. We hope it's been informational and that we've provided you with some information and resources that you can use today and scale and customize for your organizations. I want to thank Weedy for sponsoring the webinar, as well as Phil for his going through the presentation and his participation on the 405D. I enjoy working with him, and it's a great opportunity to work together on this. So appreciate everybody's participation and that of the 405D as well, and all the work that's going on there in the Healthcare Sector Coordinating Council. Sam, is there anything else? Let me turn it over to you. Anything that you have that I didn't mention?
Thank you very much, Lee and Bill. That was an excellent webinar. And just so our attendees know, I'll be following the webinar with the link to the recorded webinar, as well as the slide deck, just in case you didn't already download it from the control panel. But thank you again, and I hope everybody enjoys the rest of their week.
Thank you.